We're going to begin this hour with the search for answers about COVID, with the number of new cases in this country averaging more than 100,000 a day. There's also some possible good news we'll get to. Moderna has announced results suggesting a modified version of its COVID vaccine is more effective than the one currently available. And the company hopes to submit that data to regulators in the weeks ahead. You might say there is no one better to talk about all of this than Dr. Ashish Jha, the White House COVID-19 response coordinator. And we're happy to say he is here in studio. Dr. Jha, good morning.
Good morning. Thanks.
Now, we have a sort of surprise for our viewers. That is, Gayle King is going to be joining us remotely.
Right.
She's got COVID to ask you a couple questions. But before we get to that, just give us a reality check of where we are with COVID. Is what we're living through right now kind of the best we're going to be at?
Yeah, so what we're seeing is, rise of infections across the country. We're up, as you said, about 100,000. But this rise feels different, I think, than it often has. And that's because we're not seeing a lot of people land in the hospital. We're not seeing people in the ICU. Thankfully, deaths are really low compared to traditional. And the question is why? What's going on? What's different? One is we've got lots of people vaccinated and boosted. I think that's making a big difference. And then we've done a lot of work to try to get Paxlovid out there. This is this oral pill that makes a big difference keeping people out of the hospital. So I do think that that is what's really keeping serious illness low. That's a big goal right now, is we got to make sure people stay from getting sick.
Dr. Jha, as Tony mentioned, Gayle, she tested positive, so...
I think 4 times. She wanted to be real sure.
Right. So COVID has hit the CBS Mornings.
Yep.
So we want to bring her in. Gayle, I know you're at home joining us right now. First, let me ask, how are you feeling?
I feel really fine, but just hearing you guys say Gayle King has COVID got me like this. I know. Dr. Jha, I still can't believe I'm sitting here at home and you're there. I am double boosted. I'm double vaxxed. I can honestly say I feel okay. If I didn't know I had COVID, I wouldn't know it was COVID. I thought it was a slight cold on Saturday because I tested negative Friday, slight cold Saturday, positive Monday. And I still can't believe I'm sitting here talking to you this way because I've been so frickin' careful.
Yeah, I know, Gayle. And look, this is a very, very contagious virus. People are going to get it. It's going to be hard for people to stay away from it. But the good news, I see you as a success story. Hard to tell you that when you have COVID, but it is a success story, right? Like you've gotten vaccinated, you've gotten boosted, and that means you're not going to get particularly sick from this, and thank goodness.
I actually do feel, I have to say, very grateful that I'm double vaxxed and double boosted. So I'm not complaining about that. I actually feel very grateful. I'm now worried about long-term COVID. I'm trying to decide, should I get Paxlovid? Should I get monoclonal? Should I do nothing? Because I honestly feel okay. I know I have to travel next week out of the country, and that's why I'm considering it.
Yeah, so look, I mean, in terms of whether to get Paxlovid or the monoclonal antibodies, good conversation to have with your physician, right? In general, I believe that more and more people should be getting this oral antiviral pill, Paxlovid. I think it makes a really big difference in keeping people from getting particularly sick. So that's a good conversation to have with your doctor, Gayle. But in terms of long COVID, I think thankfully people who are vaccinated, boosted, much less likely to get long COVID. My hope is that you're going to do just fine with this.
Well, I can also say COVID doesn't take away your appetite. I was sorry to hear that. Really, I've been sitting at the table picking at my navel because I've been so paralyzed for the last couple of days trying to process. Today, I'm actually going to get up and move around the house. I'm going to do something because I've been so paralyzed waiting for something bad to happen. And honestly, nothing bad has happened to me. So I really do need to bitch slap myself around and start moving and accept this diagnosis. I know I'll be okay, and I'm hoping that I'll be back at work very soon.
Yeah. We are too, Gayle.
Yeah, I understand where she's coming from. I mean, I've avoided having it so far, and I'm thinking, Gayle's at home, Gayle's testing, we're still testing. At what point do we get to, in this country, where we do treat it like the flu? Because as you're saying, the hospitalizations are down, people are not dying.
Are we at that point right now?
Yeah, when do we get there if we're not now? And you just say, if you don't feel well, you don't feel well. You don't know if it's the flu or COVID or what it is.
Yeah, here's why I think we're not quite there yet. First of all, the number of infections that are out there, we don't ever have the flu where we get hundreds of thousands of people getting infected every day. This is a lot of infections. So we still got to work on that. Second, we are taking a very active, aggressive approach to keeping hospitalizations down. If we let up on vaccinations, if we let up on treatments, those hospitalizations can start climbing back up again. So it's sort of like we're in a battle. We're fighting hard and keeping things at bay. it's not time to let up and say, okay, this is as good as it gets. I actually think we can do much better than this, too, if we develop new generation of vaccines and keep going after this virus.
Yeah, I totally agree with what you're saying. I have a friend who was also got it the same day I did. His symptoms are much worse than mine, but I also know if he wasn't double vaxxed and boosted, he would be in a world of trouble. So I can't stress that enough, how important this is to be in this position, that you are well covered if it should hit you. And on another note, guys, this show is very fun to watch. I'm sitting here. God, I wish I was there. Ariana's there today. Yesterday you had Grant Hill and Layla, the new author at Oprah's Book Club. It was so fun to watch you guys.
Well, we're glad that you're watching. Dr. Ashish Jha, we appreciate you. And Gayle King, we're glad that you're feeling well. Get up, get out, and do something, all right? We miss you here at the table, and we can't wait till you're back.